Hello, everyone. My name is Diego Lopez Ramos, and we're going to be discussing Project Venus, an industrial affiliates program developing an application to solve breast cancer patients' needs. And this group is composed of myself, Hector Sotelo Caraballo, Kevin Bonet Guadalupe, and Diego Colon Davila.
The purpose of our research, or the problem our research centers around, is the fact that there are a lot of breast cancer patients of all ages and genders that face many challenges living their day to day. These types of patients, we think, would really benefit from tracking their medicine, their treatment, and having hold of their symptoms data. There's also a very real need for easy access and understanding of information. Medical terms can sometimes be confusing or not readily available in the patient's language. These pain points are what we aim to change. The project description, or the objective of our research group, was to develop an app intended to help breast cancer patients. We aim to solve the problems identified while also providing a pleasant and rewarding user experience. Our development followed the Stanford Design Thinking bootleg manual.
We were tasked with reading the entire design manual before discussion began on the steps to follow. Since the manual was quite brief, we were able to finish the manual in the first 2 weeks and begin working on the design modes. Because of the mid-October start date, OKRs were not developed, but we were instead able to use the steps outlined in the Design Thinking Manual, which consists of 5 stages: empathize, define, ideate, prototype, and test. The team engaged the first 3 modes during the course of the semester, during weekly meetings every Tuesday and Thursday. We were able to complete a Figma sketch as a basic wireframe of the application. That Figma sketch was validated through discussion within the team and consultation with project advisors.
We faced many challenges with interviewing patients. The main one was on how to interpret the data we obtained from them. Our solution was to use the concept of archetypes in order to synthesize our common data points into profiles that would give us a more complete and coherent picture. We ended up with 2 archetypes which we are calling Maria Robles and Janice Rivera. Maria Robles is a 35-year-old woman with a case of invasive ductal carcinoma. She weighs 134 pounds, is a full-time student, and has a part-time job. She engages in moderate physical activity and owns a dog, but doesn't go often to the doctor. She smokes, likes to go to high-energy concerts, and is often busy working. Janice Rivera is a 57-year-old woman with a case of phylloid tumors of the breast. She weighs 170 pounds and mainly does housework. She doesn't smoke and she frequently visits her doctor, but she is postmenopausal and doesn't get much physical activity. They both wish to be more proactive with their cancer treatment. They want tools that allow them to educate themselves and simplify their appointment and treatment processes. What we can see is that people can lead very different lives, but when faced with the same problem, their frustrations and goals can line up similarly. Using these customer personas in our empathizing process allowed us to come up with potential features that we are confident in their ability to improve a cancer patient's quality of life. Here are some of the features that will be implemented on the application that will facilitate breast cancer patients' lives based on our research. The first would be the ability to store documents. The second, to be able to view the latest clinical research, synthesized into a more viewable format. The third would be exercise and nutrition tips. The fourth would be the ability to add a user calendar, the ability to track visits with doctors, when, etc. And the fifth would be a symptom tracker, which would track sleep, nutrition, exercise, treatment, among others. This can be displayed for new doctors when the patient is visiting.
This Figma sketch represents the features we brainstormed. Every box represents a page of the application, and the login page, landing page, My Documents, user calendar, and user info pages are all represented along with information as to what they'll contain in the actual application.
Some of the future work that our team will be performing within the following semester are the completion of a wireframe Figma sketch of the application, the determination of which stack will be used for development, and to quickly begin the prototyping and testing of the application with the intention of gaining more users' data and increasing users' empathy. Based on our research, we have learned many valuable lessons. One of them is the understanding that there are many similar applications available in the market, but only a few that are high quality. This has led us to emphasize two aspects of the application, and those are providing high-quality information to our users and implementing useful interactive features to the application.